Hello, welcome to Facebook Live. Coming back at you today to give you some information about something we've gotten a lot of questions about lately, and I just sort of want to answer all those questions in one little session. And they all sort of have to do with our new 3D Lewin Ear Implant. So I have today, I'm not so super great with how this Facebook thing works, but Tiffany Wilkie is here, which is why we're having a Facebook Live. She's in California now. So she'll be chiming in, and she's gonna get your questions. If you're giving us live questions, we will do our best to answer those while we're still on Facebook Live. If for some reason we don't get to your question, we will go back into the comments and make sure that we can answer them for you. So we're just gonna jump right in and talk a little bit about this new technology. And it is really the product of about 3 years of research with myself and Porous, which is the name of the company that makes Supor ear implants. So Aaron Noble is the president and CEO, and he and I have gotten together over the years and really thought through what is the best way to get, as symmetric as possible an ear reconstruction for our patients. And I think, today I'm really, really happy with where we're at. I mean, we're always striving and we're not done doing things together. He and I are already looking at the next thing. But for today, I feel like this is probably, in my career, making ears for the last 15 years practically, this is the biggest advance I've seen, that has enhanced my results. So I want to kind of talk to you guys a little bit about where we've come from and where we're at today. So originally, if we go back to what I've been using and have been very happy with for a very long time, it's the 2-piece implant. So there's a thin rim. This is a Supor rim. So it's a very flexible rim, and it gets connected to a base. So although Supor does the 3Ds, the 2 pieces were also available, so we used these for quite some time. So these 2 pieces are soldered together, and then what you get is this 2-piece implant. And back here, we melt in a little more of the material, the porous polyethylene material that these implants are made out of. It's the exact same material as MedPor. And for many use, I use MedPor. Very similar 2-piece design, very minor differences between the two, but and both kind of equivalent in terms of FDA standards and such. I just find the Supor a little more preferable because it's, to me, a little easier to work with carving and such. So at any rate, our big change was what you see here, the invention of a 3D scanner that is practical, that we can capture the exact image of a child's ear. And what's so great about the scanner is, unlike an MRI or for many kids a CT scan, you have to sit still to get a good image, and that can require sedation. In these young 4-year-old kids are not going to be able to sit still long enough. But with this scanner, it is probably about 1 minute to get a scan, and I usually do 2 or 3 scans per ear just to make sure I'm really happy with the scan. But there is no sedation, there's no charge for a 3D scan for anybody, and once we capture that data, we can manipulate it however we want. So what's fantastic is you can take this incredibly detailed ear anatomy that you now have 3-dimensionally, and you basically grow it up into an adult-sized ear. So I want to show you an example. This is a model, and this is 3D printed, but it's really important to understand we don't print the ears that we use in the operating room. We're printing these models, and I use them for surgical planning purposes. But they show me exactly what the implant's going to look like, but the implant is sterile, and this is an example, of an implant, and you can see, they look very similar and incredibly thin, a little bit thinner than your actual ear because you have to cover it with tissue, the flap, what we call the TPF flap, and then cover it with skin. So we want to take that into account. So when you're done building the ear, you know, it's about as thin and delicate as an actual ear. So what's been kind of fascinating to me, I thought last fall I knew everything you needed to know about ear anatomy because I've been staring at ears and building ears for many, many years. And I, you know, humbly realized that until I started getting these models, I really didn't appreciate how different, how much curvature there is in a rim, how much dimension there is to an ear. Because when you trace it on, you know, some acetate, you just don't, your eye doesn't perceive those differences so well. So just by way of example, and some of you may have seen this image, but I find it so interesting that these were just in a few weeks, the kids that we just did, and I just put all their models together for the last few weeks of surgery, and I couldn't believe when you stared at the rights and the lefts, like they're quite different. The bowl, you know, the bowl, which is this thing, it's a little bit different shape for everybody. The rims are really what's a different shape. So what I realized is, you know, getting that realism instead of a rim that looks more mechanical or machine made. Like none of our ear rims are this straight and perfectly the same width. So I feel like, and what I'm seeing in our post-op kids so far is that we're getting a level of symmetry I could not get before. So we're really excited about that and very happy with how these are going. Tomorrow will be our 20th 3D ear. And if it were up to me, that's all I would do going forward. It's not entirely up to me, however. Not everybody can get a 3D ear. So that's one of the things I wanted to talk to you guys about is who's eligible for 3D ear and who is not eligible for 3D ear. I can scan just about anybody, but in terms of getting the implant created from that scan, we, Peripherus or Supor has the technology to do these amazing implants to exact specifications. I grow it up, tell them what size, dimensions, and characteristics I want, and they literally, within weeks or less than weeks, sometimes days, can get me a sterile implant to use in the operating room. The issue though, as you can imagine, is these implants, if they're patient specific, cost more to create. And so, at least for this moment, they're only available at the operating room, which is next door to where we are now in Torrance, California. It's called Cove Surgery Center, and that OR is able to get these implants for our patients. And if you have insurance that lets you go to Cove, there is no additional charge. Patients don't pay anything more or anything. If you do not have insurance and you are coming from another country, there is a charge related to just what the operating room has to pay for that child's scan. In other words, they just pass on the same exact cost. They don't upcharge you, so to speak. There's no additional charge. At any rate, we are very happy and excited with this new technology. If a patient can't come to Cove, then they're done at a hospital. And those are kids that have difficult airways, an insurance company that won't allow them to be seen at Cove Surgery Center, or maybe have some type of a medical condition that or a syndrome that requires them to be at a big hospital, just in case they may need admission. So those kiddos are getting these Supor two-piece implants, and they're still making really great ears. And I guess the point that I really want to make is, as exciting and happy as I am with this technology, ultimately, it really boils down to all the work that goes into covering these implants. So the only way they're successful is if they have perfect flap coverage and beautiful skin coverage. And that is, you know, what's taken me this many years to develop. So I will say the 3D ears are more challenging than the two-piece implants. They take maybe a little more work and a little more time getting everything just so, but I feel that there's a great payoff in the results down the line. Since we had just started this last fall and we've only got almost 20 kids done, probably towards the end of this calendar year, we'll have good long-term results to show you. We show you short-term results in different Facebook and Instagram posts, etc. But we'll have a little more results and sort of really be able to see the difference that it makes. One cool thing that's coming up, we've been doing some Microtia, we call meet and greets. They're kind of like a little different, more grassroots way of meeting people and coming to where they've asked us to come. So we did a poll, and the places that wanted us to visit, we've already been to Dallas, Texas, and Austin, Texas, and had a great time, met a lot of patients, have already done surgery on some of those patients, even though it's only March. We were just there 4 months ago. We are going to New Jersey and Ohio the first weekend in August. Friday we'll be in New Jersey, and then the Sunday, I believe, we'll be in Ohio. Pretty sure, Tiff, New Jersey is full, and we can't really fit anybody, but there's a wait list.
Yes.
Things always, can shake up because it's a long time away, being in August. Ohio still has some spaces. If you're interested, what's cool if you come is, I'm bringing this bad boy with me, and we are going to take kids that are age appropriate and anatomy appropriate and scan them. So what that means is, if you're within 6 months or thereabouts of getting an ear, we can do your scan and it's going to be very similar to your ear, 6 months later, and we will grow it up for age anyways. The only kids we won't scan, obviously if they're too young or they can't sit still long enough for the minute it takes to get the scan, or if there's some anatomy with the ear, if it's even a protruding ear we can scan, because I know how to kind of make it look put back by manipulating the software. But like certain ears, like if they had a bend in them, something like that, and we're going to try and fix that for them in surgery, those would not be kids that were good for scanning. In those cases, we would use our one-piece implant, which is basically similar and also basically from a real ear data, so to speak, but it's more of an ideal ear, not a patient-specific ear. It's like an ideal patient-specific ear. So that's the lowdown on the 3D Lewin Ear Implants by Supor. That's sort of what we go by. I actually can thank my patients for that, because you guys came up with the name. The hashtag Lewin Ear, I guess Tiff told me, was like a thing, so we just rolled with that thing. And
that thing is going to become a website.
That thing is going to become a website very soon. You're right. Lewin Ear. It's not up yet. Or if it's up, it's not going to the right place. I don't even know what it's doing right now. But very soon we'll have a new website, and it's going to explain all this stuff to you.
I think we should say hi to a few people.
Oh, who are we saying hi to?
What's awesome is you have so many of your patients who have had surgery are tuning in just to keep up with modern technology. But the Grosshands family, Summer Hurd, Shannon Sappington.
Hey, you're here in LA.
Your mama.
Hi, Mom.
McCarville family. Hit Millers.
Wow.
Brooke says we'll see you in Ohio.
Yay. Oh, I know. Patient pain.
Miss Ava is watching, probably with her new LOL dolls, right?
Like Miss Ava as in tomorrow, Miss Ava?
We learned about LOL dolls today, didn't we?
I did. I didn't know what an LOL doll was till Miss Ava taught me today.
But we do have a couple questions here.
Okay, questions.
Question 1. What is the earliest age? This is from Viviana. What is the earliest age you start surgery, and how long is surgery?
Excellent questions, both of them. I used to, and probably my website is wrong, I used to start surgery at 3, and that worked well until we learned that there was a recommendation from the anesthesiologists that I work with who are pediatrics trained, that basically the literature was going towards not wanting to do elective surgery until kids are 4 because of brain development reasons. based on the drugs that you're given in anesthesia. So if your surgery's longer than 3 hours, they're saying wait till 4. So for that reason, we started waiting till 4, and that was probably a year or 2 ago. What I've come to understand beyond that reason is because these 3D ears have more detail and more detail, I guess is really what I want to say. There's so much more room behind the ear and a little bit different feel. I find it advantageous to have the kids a little bit older. We can get a little more skin and we can get the flap just the way we want it. So I like doing 4. That's kind of my ideal age, but we met a patient today who was 22 and did a patient last week who was 25. So there's not an age limit if you're healthy. One of my patients was 53, who has also been on our patient panel. If you're out there, hello, Mr. Wested. Who he was older when he got his ear, and he's done fantastically well too. So that's the age range. In terms of the time of surgery, these days we are at about 8 hours for what I would call standard anatomy. So no severe hemifacial microsomia, a typical grade 3 that we see very commonly. In cases of hemifacial microsomia, syndromes, redo ears, salvages, other people's work, those cases can go longer. Somebody's been there before. So over 8 hours, whatever it may be, 10.
And what is the difference in surgery time between the 2-piece implant versus the 3D, and is recovery the same?
Recovery is identical. I'd say time is pretty identical. I have to spend time soldering these 2 pieces together, and I have to spend time refining these. They don't exactly come out 100% the way I need them when I get them sterilely. So there is modification, mostly detailed definition, thinning, things and optimizing for the patient's bony anatomy. So that still takes me, that's probably an hour either way for making the implant. So I don't think there's much of a difference.
All right. Denise said, we missed half the talk. Will this be published? And yes, after this event is over, we do publish it to Facebook and eventually YouTube as well. And so you can make sure to re-listen to all this fantastic information at that time. Some highs from Dan Schwartz, Diana Orenday, Chicho, apologize if I say that incorrectly, and Blanca wants to know when you're returning to Colombia.
I've got to get down there. I know I have so many friends down there. I know, I have to. I don't know is the answer.
And Cynthia wanted to know how much surgery costs. So the next step, if you're interested in learning more about surgeries, you can go to our current website, which is microtiaearsurgery.com.
Yes.
And you can look for the Contact Us button there. Fill out the form, and then we send you all the detailed information about surgery.
True.
And I was just thinking, I'm not able to Zoom. Could you maybe grab some of those implants and just bring them? Maybe I can bring a tripod. Just show them one more time. This is a little risky. You'll see. There you go. Oh, the Kilbys are watching. Hi.
Oh, I'll see you guys.
Nice.
There you go. They really just look very much like somebody's actual ear. No, it's pretty awesome.
You know what's really awesome? We have 45 people watching live right now.
Nice!
I think we hit
Thank you,
a
guys.
milestone there. So thanks
Nice.
everybody for tuning in, and we will go ahead and publish this so you can watch it again. Oh, actually one last question, which is a really good question. We've gotten it a couple times now.
Yes.
Is there less or more of a chance with the 3D implant with fractures?
Oh, I should have addressed that. So actually that's probably one of the biggest advances to these new implants. Essentially, I think it has eliminated the risk of fracture. These, if you sat here and held one, you would see they're extraordinarily strong. These implants, the 2 pieces that we have to solder together in 2 pieces, ultimately they have a weak point wherever they are soldered between those two pieces. Just like anything that has a joint, the wear and tear or whatnot on the ear, my fracture rate, we just did it for the new website, is 2.9% with these. So it is not a common occurrence. But as I see it, if you can get this other implant and not have, have that risk be 0%, in 100 ears that we do in 1 year, that saves 3 patients from having to come back for surgery. And like I always say, even though a risk is very, very small, and obviously we all have risks in our, complications in our practice, if it's your kid, well, it doesn't really matter if it was 1%, 2%, or 3%, it's 100% for your child. So to me, to take 3 potential kids that would be having fractures and eliminate that from my practice, that's why I love, love, love these. This 2-piece, unfortunately, it has served me so well and gotten me so many beautiful ears over so many years. But, I have had fractures that have had to come back. And actually, recently, 2 of my kids who had a 2-piece implant from years prior have come back and gotten their other ear 3D scanned. And now they're older kids, so we get like a very accurate 3D scan of their big ear. And then we took out the fractured implant here, relatively quick surgery, and put in a 3D for them. So it's like good news, bad news, I guess you could say. I mean, it's bad news to come for surgery, but it's kind of nice if you can get something that won't fracture going forward.
Another great question, if you were coming from out of the country, or actually even in the country, do you have to travel here twice for the 3D implants?
Okay, excellent question as well. So this scanner is pretty new and the technology isn't everywhere. So from certain countries, even though they are halfway around the world, those patients that want the 3D scan are traveling here for a couple days and going back home about a month or 2 before their surgery. It's not ideal. However, I will tell you, my parents are so impressive that I have had patients, including one from Lithuania, who found somebody who could scan her child's ear. So families are doing research and finding more local people, and I'm working with them. So even if they can get me a basic scan, I can refine it and do what I want with it. So not everybody has to come here for the scan. It's an option, and if I'll tell you, if you're in some really cold eastern state or some very cold country right now, it's not too bad to get a few days in our beautiful weather here, but it's of course like a crazy expense just to come for scanning. So we are working on developing contacts so patients can go a little more locally.
And since you will never brag about yourself, why don't you tell everybody how many people in the world are using this technology to create porous implant ear reconstruction with 3D technology?
I believe I am the first person to take a 3D scanned image and use that with the help of Porous technology to create a 3D implant image of a patient's ear. I don't think anybody else in the world today has done it. I couldn't swear because I don't know everybody, but at least maybe not published it yet. I don't know if I mentioned 3D printing. It's important to know this is not a printed implant. It's from a 3-dimensional scan, but it is created with unique technology as a single unit. So it's not laid out layer by layer the way a printer does. So my understanding, and Erin Noble knows this better than I do about the engineering of this ear implant, but that creates a structural integrity that gives us this ability to believe that it's not going to fracture. But it is not printed. It's not a 3D printed. And that sort of brings up another question I'll just address because it comes up at a lot of our talks, like, what about stem cells? What about cartilage? When are we going to get there? So actually, some really impressive people have already written a paper about taking cartilage cells from a microtia ear, growing up the cells, creating a scaffold, seeding the scaffold with those cells, and creating like a cartilage framework. So from a patient's real cartilage, and then they do the surgery to create the ear, and over about 5 years, the original structural support kind of dissolves. So that's already been done. The issues have to do with the longevity of these cartilage implants. Like, we don't know yet over time what's gonna happen to these. So of course we're gonna need several years of operating on people to see how they do over time when they get injured or what happens. That will hopefully eventually come to pass, but I don't see it in the near future, at least not if you want your kid to not go to surgery without years of data as to how those kids have done over time. So that's kind of where we stand on that. Like, we're hopeful, but I don't think we're quite there yet.
Couple more questions. I'm loving this.
Okay.
Thanks for chiming in, everyone. Wesley Pierce's mom asks, are the 3D implants, are they better for the long term, or is it just better for aesthetics?
I would say both. The reason I would say better for long term is the fracture incidence. Like, you sort of can't get around the fractures being a possibility with the 2-piece implant. So at least it doesn't necessarily, we have an option that's 1 piece, just like this, but not a 3D scanned patient-specific ear. That's my design, so we call that the Lewin Ear Implant, and we call the 3D scanned patient-specific ones 3D Lewin Ear Implant. The 1-piece Lewin Ear Implant we've been using since 2017 and have had no fractures. So for longevity, I think that's pretty exciting.
Another question that people are typing in is bilateral. Stacy asks, if a patient has bilateral microtia, would you scan a sibling or a parent for the 3D ear?
Wow, Stacy. I don't know if I know who Stacy is, but interesting you should ask, because we have the sweetest story last week where we had a patient who was bilateral, and we did scan her sister's ear when we were in Dallas, right?
And
Dallas
they are watching right now.
Oh, and they are! Anyways, so we did their first ear with her sister's ear as the model, and it was the cutest, most perfect ear for her sister. But that was really special and sweet, and so I think it's kind of neat myself, so I, of course, would be willing to do that. So yes, the answer is yes.
And if they, let's say, don't have the ideal anatomy, what would you do with bilateral?
That's when we use the 1-piece Lewin Ear Implant, what we call a so-called ideal ear. It just has very typical ear anatomy and looks very realistic, because it's taken from kind of a compilation of many people's ears, for lack of a better way to describe it.
Oh, cute. The Sappingtons are watching and grinning right now. That's
Aww.
so cute. Someone did ask again, what is the website to fill out the form?
For contact us.
And because
Okay.
it's Facebook Live, this is so unofficial. www.microtiaearsurgery.com/contact-us. That is the website. And also, if you have just questions in general, you can always send them to info@lewin, LEWIN, MD.com. That is fancy right there.
That is awesome.
Well,
We're being it
everybody.
here in LA. Yeah, thank you all for chiming in, and thank you for all your great questions, and thank you for your interest in what we're doing. We have so many wonderful supportive families. Tiffany mentioned so many names of patients that I've already taken care of, and I love that you guys always are so supportive and you help our little ones coming up, so to speak. So anyways, you guys are just awesome. Thank you.
Wow, someone just chimed in from Africa, so make sure to tune in and watch the
Nice.
rest. Oh,
Awesome.
one last time. Thank you, Shannon. I failed. www.microtiaearsurgery.com/contact-us. Sorry, it kind of goes out of focus. You know what? We'll go ahead and type that link into the comments since I'm failing at my job. So
I'm still keeping you, baby.
All right,
You're
awesome.
still good. All right. Thank you,
Bye-bye.
everybody.
Bye.
Bye.